When and why is anti-D offered? The first recommendation, at least in most high-income countries, is that anti-D or RhoGAM should be offered within 72 hours of any potentially sensitizing event. It's important to know that the 72-hour time frame is not an absolute cutoff. We do know that anti-D can be effective if given up to 10 days after a potentially sensitizing event, but sooner is better. From my education, I learned that the 72-hour time frame, Blyss, was because they tested it on prisoners and they only had them for 72 hours before they had to send them back to the jail. One of the key paradoxes is that anti-D is the only medical treatment with which the following three things can be said. It is given to a person, the mother, who doesn't benefit from it. When it is given in pregnancy, it is given to the possible detriment of another person who won't physically benefit from it. And by that means, if you're giving it to all pregnant women, say at 28 weeks, some of those babies are Rh negative.
Yes.
They're not going to benefit from it. And there might be some detriment to giving this product. And it is given for the possible benefit of a person who does not yet exist or who may never exist.
The next pregnancy.
The next pregnancy. There's no other medication that you would ever do that. Here's a question. How is anti-D made? Because this is something that everybody wants to know.
The blood product.
Anti-D is a medicine made from pooled blood. Donations from a number of people are mixed together to make anti-D. And that can mean that the demographic profile of blood donors is different.
Yeah, but they screen them.
Well, they can, but there's certain things that they can't necessarily screen for. And also because anti-D is a medicine made from blood and a very small number of people may have allergic reaction to it. There are 4 key side effects to getting a shot of RhoGAM. One is an injection site reaction. The second type of side effect is that between 1 in 10 and 1 in 3 women will have systemic reaction, such as fever, chills, skin rash. Third type is an immediate reaction, which is anaphylaxis. And the fourth category of possible side effects listed by the manufacturer is that of blood-borne infections. Certain things can be screened for, obviously hepatitis C, HIV. Are they screening for spike protein?
Sure, they're not.
Again, these are not meant to scare people. I've never seen this sort of thing. And I just think that she's just being very honest that if somebody says it's perfectly safe, that's not true.
It's not true informed consent either, right?
That's right. These are just observations. But what we're doing here is trying to give people informed consent. So in the future, if they have a friend or a cousin or somebody who's got questions about RhoGAM, they can refer them to this podcast.